name is Alyssa Klainsmith. I am a senior nursing student, and I'll be checking off Brian on Foley's and NG tubes.
Okay, here's a scenario. I enter the room, ensure patient's privacy, check the orders, confirm that everything is up to date with the patient, checking for any kind of medical history of head traumas, medical, broken nose, peripheral deviations, and such. Perform hand hygiene, approach the patient, apply clean gloves, identify the patient. Hi, my name is Brian Bacallion. I'm a Liberty nursing student. I'm going to have you verify your name and date of birth for me. Okay, Mr. Hayes, thank you so much. Ms. Hayes. And patient identifier as well, number 2. Okay, well, we're going to first insert a nasogastric tube into you. So, over here, I'm going to pull the blanket down. Have the patient set in a high phallic position. And my equipment's already preset for me. Place a towel. Okay. I have my tube. Okay. And okay. Measure the tube length from the nose to the ear in the xiphoid process. So we identify that right here. Okay. Place my first tape over here. And next I would lubricate it. Actually, I'd have the syringe to place air into the patient as well. But I would lubricate it, and then I'm going to coach the patient through while the patient's in high phallic position, and have him have water as well on his hand. Beforehand, I may want to assess the patient's for peripheral deviation as well. And I slowly, after lubing it, insert with the tube facing down. And little by little, if the patient tends to choke or gag with difficulty, is resistant, I slowly pull some out and have him drink some water, and we'll stop. And then we'll proceed again. Once I'm past this gag reflex, I'll have him flex his head now, whereas before his head was bent back, and we'll proceed more deep, slowly. So once this is placed, check placement, I'll have to auscultate. My syringe is already pre-attached, so with air, and I'll administer maybe 30 cc's of air, and I'll auscultate where the stomach is, and listen for their gurgling sound to make sure the placement of the tip of my tube is in the stomach. Also, we can, last resort is to perform an X-ray, and as well, and then when we go ahead, once that's placed in here, once this is placed, I would clamp the patient's nose and have with tape, and then tape it, and then pin this to the patient's gown. Okay, and removing it, and that should be the procedure for that. And also to confirm placement of the tube is to use another syringe, aspirate the given amount of cc's of gastric fluid, place it, and if there is gastric fluid present that's been aspirated, that confirms the placement. And that would confirm the assessment for inserting the nasogastric tube. And as well, I'd have the patient drink water as I'm coaching it through with water once I pass the gag reflex as well. And it's important to know when I'm taking out the tube, I'd have the patient drink water just to avoid gastric reflux, acid reflux, and I would have to aspirate. I'd have to aspirate air. I'd have to push in air into the patient as well, his GI tract, before taking it out. Next assessment, take out my gloves, perform hand hygiene, confirm the patient's orders again, apply clean gloves, remove the bed, remove the top sheet. Okay. Set the patient's table at waist level at a comfortable position. Assess the patient's pain by verbalizing. Have him verbalize it from a scale of 1 to 10. And next, have my clean gloves on. Help the patient in a dorsal recumbent position while I have my clean gloves on. My assistant will help me on the other side. Exposing the areas over here. Further assessment. Setting up my sterile field over here. Making sure that my gloves are appropriate size, and remembering rules of sterile field, not to turn my back. Like I said, making sure that the gloves are on the right size for the clinician. I assume these gloves would be placed on already. Perennial care is provided beforehand, and setting up my placement of the mat, assuming that I have sterile gloves on. Shiny side down. And have the patient, if he can help assist, move his hips up, and making sure that I do not make contact with the legs. Okay. Mat set up. This top piece would be set up for privacy as well. Okay. Check for bubbling in the tube, catheter. Foley catheter. Okay. Non-dominant hand placement. Okay. My gel is ripped open, pushed down, and before I do that, I will go ahead and put the syringe in here as well. CC amount's already included. Identifying the patient's labia and urethra, opening and assessing. So I go ahead, and once I spread that open, they clean from the outer ridge down, dispose, and the other outer ridge and dispose. This would be disposed elsewhere. And the third one from the middle, like from the urethra, down and dispose. Now it's clean, and the perineal area is clean as well. Sterile field. Slowly insert it, and as said, this was lubed about 3 inches. Slowly insert until, and I had the patient hold her breath as well. And I keep inserting until I find fluid having a decent flow out, and then I administer another 1-2 inches. Okay. Clamp this. You clamp on the side, the patient's leg over here, and no, we don't want to have it over the patient's leg. We have this over the patient's leg as well, and clamp to the side. Right below the waist and further away from the buttocks. And once that's inserted, we would administer the solution that was in the tube as well, the cc amount, and that will be noted on this end. Sterile field has been broken, can't touch with non-dominant hand. As I said, it's over here. Now when taking out, coming later and after, we're maybe a couple weeks, 2 weeks after, or 7 days after, removing the catheter from the patient, I'd go ahead, perform hand hygiene again, apply sterile gloves. We have a new syringe, and deflate the tube with the amount already in. The amount of solution that was administered is the same amount of air that I must aspirate from the patient. So if it was 5 cc's, I must aspirate 5 cc's of air. That way we can avoid any kind of obstruction, mucosa damage, mostly. So I slowly take it out and procedure, and this will all be disposed by then, and the patient will be covered as well. Sterile gloves are off, and I'll provide perineal care as well, and that sums up the assessment for inserting a catheter and taking it out.